Sleep apnea. It's a huge problem. I hope to give everybody today a reasonable sense of concern for their own health and the people that they know, because we're talking about a large segment of the population here. And although sleep isn't part of the terms that we use, the real mechanism is breathing. People aren't breathing at night when they're sleeping. Turns into all kinds of social issues, marriage problems, problems at work, headaches, depression. One of the biggest groups of drugs prescribed worldwide are antidepressants and anti-anxiety drugs. So the people that I see, we get off medications. They're misdiagnosed most times. They may have had a bit of clinical depression, clinical generalized anxiety disorder, but they're not sleeping and they're not breathing properly at night when they're sleeping. Heart disease is well documented for over 20 years, being related to obstructive sleep apnea, 4 to 6 times higher rate of heart attack, stroke, high blood pressure. And yes, I've treated, currently have, as many other people, executives, airline pilots, LRT drivers, professional truck drivers who've all fallen asleep at the job. And it's a huge dollar factor in the automobile industry and insurance and healthcare. And we've only begun to scratch the surface on this problem here. So in people terms, in real terms, people who have diabetes, headaches, anxiety, sore throats, weight gain that's unexplained, acid reflux, car accidents, depression, it just goes on and on. Poor work performance, hormone imbalance, night sweats, poor sleep, insomnia, and it can end up in death. All of these things are common complaints that people come into our clinics and tell us that they've been experiencing and that they've been experiencing for many, many years. There's 2 proven treatments for obstructive sleep apnea, and I like to include insomnia in that because insomnia is most commonly misdiagnosed as well. It's CPAP, which is continuous positive airway pressure, or an oral device that you'll see a picture of shortly. So in our clinic, we get involved in the evaluation, the treatment, and the follow-up. This is a chronic disease, this is a chronic disease, just like hypertension or diabetes. People need lifelong care. It only gets worse with time. The literature will tell you 60 to 70% success with dental devices. Typically, we're getting better than that in our clinics. I've really only been doing this for about 18 months, and just last fall we did a clinic pilot in Toronto. Just to talk a little bit about the technology, we've developed clinical protocols and software that's just in its 3rd version now for being going to commercial applications that helps with patient assessment, treatment decision making, electronic medical record. But we're also looking at some of the therapeutic dental devices to compete with some of the over-the-counter things. There's a million things on the internet that people are spending their money on, or they're buying at their local London Drugs that just don't really do anything. So we think there's a huge opportunity to put some simple devices out there that are going to help in an initial way for individuals. I've been working with the Psychotech company in Calgary. We use their sleep recorders. It was developed by John Remmers at Foothills Hospital a number of years ago. We're working on a beta version of their sleep tester now that measures upper airway resistance, which is a limitation in the flow volume for respiration at night. And that's a whole area that's been missed. Previously, we're just looking at when there's apnea, no breathing at all, or if there's a 50% reduction, which is hypopnea. But when you get repeated breathing where there's even a 30% reduction through the night, that's showing up significant clinical symptoms for individuals that need treatment. And that's really the bulk of the patients that have the problem. I see people who are 20 years old and 85 years old. Most of them have normal body weight. They don't have comorbidities or most of them yet haven't got the comorbidities like hypertension or diabetes. But I do treat people who are much sicker. But that's just to let you know that your family, your neighbors, yourselves likely have a significant breathing issue at night, and it's an evolutionary thing that's developed over time. although animals will snore, they don't have sleep apnea. So this is the area that we're targeting with this beta research algorithm that we're using with Sagatech out of Calgary, looking at, it's typically a younger demographic that have huge problems. Often they're on the anti-anxiety and the antidepressant medications. And people thank me for saving their jobs, saving their life, saving their marriage. I even helped a young girl recently get married because she was told that she could only use a CPAP, and she's in the dating mode. She didn't want to use that and meet an individual, so we got her a dental device. She's actually engaged now. So a lot of people, we're talking big numbers, 70% of the population just in North America, 141 million. So our company is, in the last 6 months, we've slowed down on the research in the active clinical phase, and we're trying to develop a corporate team, raise some money, and then go forward with a strategic plan to open 67 clinics approximately in the next 5 years all over North America. I've already been to Sydney, Australia, where CPAP was invented by Colin Sullivan. They do a huge amount of research there and in CPAP and also the dental device area. A city the size of Edmonton could have 4 clinics typically. I have contacts now with research and clinicians that I'm working with in Japan, Australia, and in Europe. So I talked briefly about the over-the-counter stuff that's out there. People buy Breathe Right strips that go on your nose. You see the athletes wearing. It does improve breathing somewhat, but it's really a subclinical result. CPAP is, I mentioned before, that's a picture there with, it's a pump with the mask. It has about a 50% failure rate, but the thing is that 95% of people in North America get this treatment if they don't come into a dental type clinic or a combined multidisciplinary clinic. And just the exhale sound from this, even if the CPAP machine isn't generating much noise, you get that Darth Vader. And so somebody that's sleeping beside you, they don't get a very good sleep. So you've solved one problem, but you actually created another one. And then this is a picture of a dental device, which is just like a sports mouth guard or a grinding device that fits over the teeth. This isn't something that was just new or invented recently, and it's been recommended and demonstrated, and it's in the guidelines now for the Canadian Thoracic Society as well as the American Academy of Sleep Medicine, that it should be recommended, dental devices first, for regular snoring, mild or moderate sleep apnea. This just talks a little bit about kind of what my company's done in the last little while. I'll skip through some of this. We try to educate the medical community. Family physicians all over North America don't get a single hour of sleep medicine in their programs yet, and there's very few sleep physicians out there. So it's a numbers problem. We need to educate the medical community. We need to educate the corporate community who are losing billions and billions of dollars in unnecessary health care, insurance, and automobile expenses, and let the public know. So we've been involved in TV and newsprint stories, advertising on the radio, direct mail outs, and a bit of lecturing to the medical community. We haven't even touched on the stakeholders in the corporate area there.